Welcome to Medex Physiotherapy. In this video, I am demonstrating the basic exercise for back pain. So this exercise helps to reduce the back pain and improve the mobility. If anyone feels any of the exercise while practicing aggravating your pain, please stop the exercise and consult your physiotherapist or a doctor. And this exercise is basically designed for to relieve the back pain and improve the mobility. Now I am demonstrating. The first most exercise in this back pain is called as cat and camel. In yoga it is called as Marjalasana. And if you are going to practice this exercise, you can use any couch or bed or a physio mat as a yoga mat. You have to be in the four-leg position, and the first most important, you have to mobilize your spine by bending your neck and raising your spine, and breathe in and breathe out normally. And now you are doing the extending your neck and depression of your back. So this exercise helps to mobilize all the 33 bones is present in the spine, and it gives the mobility as well as improve the blood circulation. Hold it for at least 5 to 10 seconds, up to 30 seconds you can hold, and repeat it up to 2 minutes. This very simple exercise. And this is the basic exercise for everyone. Next exercise is called as pigeon pose. In this pigeon pose, we are going to stretch the tensor fascia muscles, and this muscle, when it becomes tight, it produces the back pain. Especially runners and walkers who walks more, they get the pain at the L4 L5 because of tightness of the TFL. I am demonstrating now how to stretch the TFL. You have to keep one knee forward and the another knee backward, and fold the leg, and foot should be a little bit forward, and we have to forward straight. So this exercise, we can stretch our lats, the latissimus dorsi muscle along with the TFL. It's a complete stretch to your back as well as the hip. So this exercise helps to relieve the back pain, hip pain as well as the knee pain. And if anyone got increased pain in this exercise, you should avoid for a few days, then again you can practice. Then hold it for 30 seconds to 1 minute and repeat for 3 times. Now I am performing an opposite side. Now if you want to stretch on the left side, just fold the opposite leg, then foot a little bit forward, then bend completely forward. So hold for 30 seconds to 1 minute. Do it for 3 to 5 times. It reduces the maximum back pain through this exercise. So after this, after TFL stretch, I am going to demonstrate how to stretch the hamstring and the calf muscle, because we have to stretch the calf and the hamstring thigh muscles, because if we improve the flexibility, automatically it reduces the stress on the back. Whatever activity, we have to bend forward. If you stretch these muscles, it gives a complete relief on your back. The first exercise, hamstring stretch. In that, we have to elevate the leg straight, and you can use any belt or a rope to stretch the hamstring and the calf muscles. So hold it for at least 30 seconds to 1 minute. This is the alternative method to forward bending. If anybody having back pain should avoid the forward bending. So how to stretch your muscles, how to improve your flexibility, how to maintain the flexibility through this exercise. So if you are doing a stride, daily increase the range. Then you have to do outward stretch. So if you move the leg outward, you are stretching the inner thigh muscles. So hold it for 30 seconds to 1 minute, repeat to 3 to 4 times. Then now do it on outward. Now it is stretching the TFL as well as the calf muscles and the outer thigh muscles. So this exercise is very helpful for having a back pain, sciatica, and were unable to bend forward. Those people can do regularly to improve the flexibility. Hold it for at least 30 seconds to 1 minute. Then bring back. In the same exercise, I am demonstrating opposite leg. So now I am stretching a hamstring and the calf muscle. One most important thing, you should not bend this opposite leg. If you bend, this will be relaxed. So we should press this leg and lift the leg straightly and hold it for at least 30 seconds to 1 minute. Then do it on opposite side and hold it for at least 30 seconds to 1 minute. This will stretch the outer thigh muscles and the calf muscles and the TFL. And do it on the opposite inner thigh muscles stretching. You have to move the leg outward. And next, I am demonstrating the different exercise. This is called as Iliopsoas stretching, because most of the patients they develop long sitting posture or forward lifting weight, and they develop the Iliopsoas tightness. Even they do, whoever they practice the curl ups, they also develop the Iliopsoas tightness. So who are having Iliopsoas tightness, we have to do the stretching of the Iliopsoas. I'm just demonstrating the how to do Iliopsoas stretching, self stretching. And this is the pose, we call it as a Vajrasana or Virasana in yoga. In this pose, we have to lie down, back side, and hold it for at least 30 seconds to 1 minute. And this exercise, who are having acute severe pain should not do, because this may aggravate and it is difficult to perform. And who are not able to do directly, you have to do gradually, day by day. This position, you have to hold the hand this position. Daily you have to bend little bit, so you can bend completely backward. And through this exercise, we can improve the hip mobility, knee mobility, and the ankle mobility. The next exercise I am demonstrating the simple form of stretching of the Iliopsoas. This is called as figure of 4 stretch. We can do this exercise, hold it for 30 seconds to 1 minute, so we can stretch the Iliopsoas. So to do the opposite side, okay, this is very simple stretch. We can do it on opposite side. So after this, the spinal twist exercise is a very simple exercise. We can keep both the legs straight first. Now I am stretching on left side of the body. I'm just crossing the left leg and holding the right hand on the left knee and keeping my left hand on the back side and stretching, and moving the head towards the opposite side and pushing the leg downward. So it stretches the complete spinal muscles, especially paraspinal muscles, hip muscles. So now we have to do on opposite side. This is a very simple exercise and gives a great relief for who are having a back pain and improves the spinal mobility. And these are the basic back pain exercise and basic stretching. In the next video, I will teach how to strengthen the back muscles and how to improve the strength of the back. And please practice this exercise. If any exercise aggravates the pain, please stop those exercises. And thank you for watching this video. Please share our videos and subscribe our channel.